we're going to be doing some breath work. This one is called Bhastrika, which is in Sanskrit means bellow breath. Bellow breath is a stimulating pranayama. Pranayamas come from yoga system, and it is a 8-limbed yoga system, and pranayamas is the 4th limb. What we know as yoga in the West, called yoga asanas, yoga poses, that is the 3rd limb. So what do the pranayamas do? They help prepare our body for the next step of meditation. They also help tone the body, tone the nervous system, and also streamline our respiratory system, clean out our respiratory passages. With me here, I have Dr. Supriya Paidemarry, and then I have Dr. Allie Hecht. So we are all going to do some practice of Bhastrika, which is the bellow breath. First, I should explain what pranayama means. Prana means the vital force or vital breath in Ayurveda and yoga system. That is what sustains us. That's what gives us life. When there is prana, there is life. When there is no prana, there is no life. So which is the vital energy. And ayama means expansion of the breath, and yama means control of the breath. So this involves both expansion of the breath as well as control of the breath. Why do we do it? This helps condition our body, and from the yogic tradition, this helps tone the body, cleanse our respiratory tracts, including nasal tracts, cleanses, and also it can calm the mind. Bhastrika is a stimulating pranayamas. It can stimulate the mind. It also stimulates appetite from the yoga system, according to yoga system. It also may increase blood pressure and heart rate transiently, but after one finishes doing this particular pranayama, then it restores the parasympathetic system. So the elevation of blood pressure and heart rate are generally considered transient. First I'm going to demonstrate, and then my colleagues are going to join with me. We are going to do a few rounds of it. And at the end of it, we will also have a question and answer session. That will be more relevant in our clinical practice. So, Bhastrika is bellow breath. Bellow breath involves forced inhalation and forced exhalation. So there are a couple of things we need to be mindful of when we are doing this particular practice. One is, typically done after doing yoga poses. In some cases, in some yogic traditions, it is done while holding the pose. So that's a step more difficult than what we're doing. So stimulating pranayamas, they need to be approached with some caution. Again, there are going to be 3 paces, 3 speeds here. One is the slow speed, which is going to be most beneficial. It is calming. There is a middle tempo that is slightly stimulating, and then there is the fast tempo called breath of fire, and that is extremely stimulating. So the caution here is one needs to start with slow and gradually work their way up. Going to the faster pace may result in lightheadedness, passing out, and things like that. So first I'm going to go ahead and demonstrate the forced inhalation and forced exhalation in bellow breath. So most of the pranayamas start with a normal breath in and a long breath out. It's almost always begin with exhalation. And then when you do a deeper exhalation, the next breath in will be deeper as well. So sit in an erect position with your feet touching the ground, shoulders slightly pulled in, neck slightly tucked in, chin slightly tucked in. It's a meditative posture. Again, one more thing of caution is that it should be done on an empty stomach. That way you'll have a nice appetite after this. doing it empty stomach may trigger some acid reflux and also cause increased appetite. Forced inhalation and forced exhalation. And when you're inhaling, you are using the chest and the shoulder muscles. Lift them up, lift the chest, lift the shoulders as much as possible. Try to get a lot of breath in a quick burst. And then you're forcing it out while bringing your shoulders and chest down. So I'll start with one, and then we can do it together. So, so that is one round of forced inhalation, forced exhalation. Make sure to exhale completely. When you're trying to exhale quickly, some people may not exhale completely. Then it may cause lightheadedness. So exhaling completely empties the air from the lungs. So what I did here was forced inhalation. I put some effort into it, and then immediately forced exhalation, completely expelling the air. So, okay, so you guys are ready? Okay, so let's begin with a normal breath in, and then long breath out, and then the forced breath in, okay, so we can pause here. Typically, you can do a cycle of 5 to 7 breaths. Have a napkin handy, because if we have any congestion in the nose, mucus in there, that may sprinkle out when you're exhaling. So, this is the slow pace. You're doing at a rate of about anywhere between 5 to 8 breaths a minute. That is the slow pace. And then once one becomes proficient, then they can increase the pace. When do I do it? I usually do it during the allergy season when my nostrils are blocked. And doing this clears my nasal passages, and I can breathe better. So it helps clear the nasal passages. Another time I do it is when I'm low on energy. I do a quick burst of these things, and then that brings my energy back up. And then I also do it when I'm feeling cooler. This is a heating pranayama. You can feel the heat immediately after doing this. So, now, any questions on your experience? Did anybody feel lightheaded? Slightly, yes. Yeah. It's not uncommon to feel that, but again, if somebody feels lightheaded, I would say it's stop right away and then take a few minutes break, and then you can resume. But when you resume, making sure that you're exhaling completely, because in our hurry to exhale forcefully, it's not uncommon to not exhale completely. So that can result in lightheadedness. So now, any other questions?
Do you typically have your eyes open or closed?
I usually do it with eyes closed. Typically, it's better to do with your eyes closed, but at the same time, eyes open is fine too. But again, what I find is when my eyes are open, it's easy to get distracted by visual stimulus. So then closing the eyes cuts out that stimulus and focus on your breathing process. And the questions about who should do it. If somebody has high blood pressure, heart disease, high heart rate, or nowadays we're seeing increasing episodes of POTS, partial orthostatic tachycardia syndrome, where standing up causes increased heart rate and then causes lightheadedness and dizziness. If those conditions, yes, please don't do that. And then pregnancy, say generally advised not to do it because it's a stimulating pranayama. You don't want to stimulate the labor. So those are the things. And do you have any questions about? Now we are using it in clinical situation. Any questions about what do we have?
Are there certain conditions that it's good for?
Yes, it is good for. One is cleaning the nasal passages and sinus congestion. And also, as I said, it is good for a burst of energy. And also, if somebody's feeling cold all the time, they can do it for a few minutes, and then that can get some warmth, give them some warmth. And then usually when we do it, do a cycle of about 7, and then you can repeat 2 or 3 cycles with 2-minute break each if somebody's not feeling dizzy. I'll just briefly mention, any questions, Supriya?
I think you answered them all.
Okay, so I just want to mention a few studies on this pranayama. Even though it may seem like it is stimulating, studies show that it transiently increases heart rate and blood pressure, but after finishing the pranayamas, there is an increased parasympathetic tone. So there are some studies that show it improves the lung capacities, like functional vital capacity, and then it also can increase the amount of breath we exhale in 1 second, called FEV1, the lung volume. So it can be useful in people who have breathing exercises. But again, one caution here is somebody has breathing problems like asthma. One thing is you have to make sure that it doesn't trigger the anxiety and trigger an asthma attack. And then second thing is it does improve blood pressure. It does improve the heart rate in the long run. Immediate effect is increased blood pressure and increased heart rate. So it is also used in increasing attention span. One study showed that people who did this study, who did the practice, about 10 minutes, they found that their attention span improved. It has some. This study was done mostly among the adolescents, and they found that their attention span improved. So this has some implications in ADHD. So we don't have any studies in ADHD, but again, this could be used in the future. So these are some of the advantages of doing the practice.